think it was going to be this difficult, did you?
No, I didn't. I thought we'd have a few choices.
Well, this is 20/40 vision. This is what you need to be able to see to not have a driving restriction for like you can't drive at nighttime.
The Senior Charity Care Foundation exists to help seniors that are in need of vision, dental, and hearing services. In Utah, we have over 26,000 seniors living in poverty. And while many of these may have Medicaid or Medicare, there are significant gaps in services which people can't pay for. And in this case, specifically with Medicaid and Medicare, there are gaps in dental, vision, and hearing services.
I'm going to rotate it back into place, and I want you to stop me when it seems like it's pretty clear.
That's good.
Pretty good here? Okay. It's hard to say that vision should be optional or a luxury, right? Everyone should have access to not just vision, but good vision.
The fact that Senior Charity Care goes above and beyond to make sure that the people can at least take care of their teeth and get the minimum requirements. These people shouldn't have to decide between having teeth and not having teeth, or having pretty teeth and not having teeth.
One more set of lights here with the different microscope.
It's like wearing a pair of new shoes in your mouth.
I worked for 19 years. I was forced to retire. I didn't have money. I do have good insurance because I got Medicaid and Medicare, but they don't pay for dental. That is why I've gone the way I have gone for so long, because there's just no way I can afford it.
It's been at least 20 years since I've seen a dentist. If I had to pay for it, I would have to sacrifice all the surgical care my wife has had, and my wife wins.
Senior Charity Care assists these seniors by directly providing dental, vision, and hearing services through a mobile model. So we actually bring the services to where people live.
To get a ride for wellness, I have to call 2 weeks in advance. Today, if I would have had to go somewhere, I couldn't have used my power chair. I can't go out in the snow, so I would have had to call it and cancel it.
It really is a privilege that you come here. We remain here most of the time, inside the building. And to have somebody taking care of us in the building we live, oh,
that is complete awesome.
In case of a dental clinic, we will fully set up all of the equipment so that we can provide exams, we can provide cleanings, extractions, fillings, and even dentures. At our vision clinics, our optometrist brings all of his diagnostic equipment. He can provide complete exams, including eye dilation and all of the things necessary to help correct vision.
Just because we're charity doesn't mean that it isn't or it can't be a fun experience. Everyone deserves the best.
As an audiologist myself, I know how important these services are. Lack of social connection and communication is one of the largest factors in a poor quality of mental health and even lifespan with our seniors.
If you can't function and do the things you want to be able to do, whatever it is, and suddenly you can't do that anymore, that can take a toll on your mental health.
Being able to see well is beneficial. It gives me my independence. You know, I would hate to give up that independence because my eyesight wasn't good enough.
I've sewed my whole life. I started sewing when I was 8 years old. I do a lot of quilting. It gives me self-esteem. I look at things that I make and I think, oh, I did that.
It is a little bit of a challenge sometimes when people don't have healthy teeth. Their diet changes, their habits change, and it's really kind of debilitating to a person's self-esteem.
Mentally, I really feel ridiculous without my teeth. Physically, at least I can eat an apple.
You will notice that people that don't have teeth, they're not healthy. We need our teeth, you know, for our basic health.
Many of the seniors that we see have gone a long time without care. The wonderful thing about Senior Charity Care is that we actively fundraise, we have donors, we write for grants, we have this wonderful support that allows us to provide this service at no cost for those that can't pay, or at a low copay so that they can contribute, but they never have to pay the full cost.
It's been approximately 10 years since I started working with Charity Care. I've had every problem imaginable, and they have helped me with all of it. I just thank all of you.
We were saved. We will, you feel, oh my goodness, now I can have teeth, I can have glasses.
I wouldn't have been able to do this without their help. And I would compliment them and shake their hands real good.
You do not know the impact that gift will be on a person just like me. Because without that money, I can't have these beautiful teeth that I'm gonna have. I'd look like this the rest of my life, and I don't want to live like this. You're one of our angels, and you will help us to live longer, to be able to enjoy our grandchildren, to be able to enjoy our children.
Senior Charity Care currently serves seniors who reside in Salt Lake, Davis, and Weber counties. But as we know, not only is the number of seniors increasing in Utah, there is need in every county in the state, and Senior Charity Care plans and hopes to be able to expand services to every senior in need within the state.